Question 1. Governance review demonstrates that an optometric assistant has been interacting with a patient who expresses difficulty with judging distances and perceiving three-dimensional space, stating, "Things look a bit flat, and I sometimes misjudge how far away objects are." The assistant has noted the patient's comment in the chart. What is the most appropriate next step for the optometric assistant in this scenario, adhering strictly to the optometric assistant? ROA regulatory framework. Option A. Attempt to conduct a series of informal visual acuity tests to see if the patient's reported issues correlate with reduced sharpness. Option B. Document the patient's subjective report of depth perception difficulties and immediately relay this information to the supervising optometrist for further evaluation. Option C. Advise the patient that depth perception issues are common and often resolve on their own with time, encouraging them to monitor it. Option D. Ask the patient to describe their depth perception problems in more detail, and then offer suggestions for compensatory strategies they might use. Correct answer is B. Document the patient's subjective report of depth perception difficulties and immediately relay this information to the supervising optometrist for further evaluation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the optometric assistant to interpret and act upon subjective patient feedback regarding depth perception, a critical component of binocular vision, without direct clinical diagnostic authority. The assistant must balance patient comfort and accurate information gathering with the understanding of their scope of practice, ensuring they do not overstep into diagnosis or treatment recommendations. The potential for misinterpretation or inadequate information gathering could lead to delayed or incorrect clinical decisions by the optometrist. Correct approach analysis. The correct approach involves meticulously documenting the patient's subjective report of depth perception issues and clearly communicating these observations to the supervising optometrist. This aligns with the ROA Registrar of Optometrists guidelines for optometric assistants, which emphasize accurate patient history taking and clear, objective reporting of findings to the clinician. This ensures the optometrist has the necessary information to proceed with appropriate diagnostic testing and management, upholding patient safety and the integrity of the optometric process. Ethical practice dictates that assistants support the optometrist's diagnostic role and do not assume it. Incorrect approach is analysis. One incorrect approach involves the assistant attempting to perform informal depth perception tests or offering subjective opinions on the patient's visual function. This violates the ROA framework by exceeding the defined scope of practice for an optometric assistant, which typically does not include independent diagnostic testing or interpretation of visual acuity and binocular vision anomalies. This could lead to inaccurate or misleading information being presented to the optometrist, potentially compromising patient care. Another incorrect approach is to dismiss the patient's concerns about depth perception as minor or unrelated to their primary complaint, without thorough documentation and reporting. This failure to adequately record and communicate subjective patient symptoms is a breach of professional responsibility and ROA guidelines regarding patient care and record keeping. It risks overlooking a significant visual deficit that could impact the patient's daily life and safety. A third incorrect approach is to provide the patient with unsolicited advice or reassurance about their depth perception without a formal diagnosis from the optometrist. This constitutes practicing beyond the scope of an optometric assistant and could lead to the patient delaying or foregoing necessary clinical evaluation, potentially exacerbating any underlying condition. Professional reasoning. When faced with a patient reporting subjective visual disturbances like depth perception issues, the optometric assistant's primary responsibility is to act as a conduit for accurate information. The decision-making process should prioritize 1. Active listening and empathetic acknowledgement of the patient's concern. 2. Objective and detailed documentation of the patient's subjective report, including specific examples if provided. 3. Clear and timely communication of these findings to the supervising optometrist. 4. Adherence to the established scope of practice, avoiding any diagnostic or treatment actions. This systematic approach ensures patient safety, supports the optometrist's clinical judgment, and maintains professional and ethical standards as defined by the ROA. Question 2. The efficiency study reveals that several optometric assistants are struggling with the precise meaning and application of common optometric terms when explaining procedures or findings to patients. Which of the following actions best addresses this issue while adhering to the ROA framework for optometric assistants? Option A. Assistant should infer the meaning of unfamiliar terms based on the context of the conversation or by looking up definitions on general internet search engines. Option B. The assistant should proceed with their best understanding of the term, assuming that most patients will grasp the general idea even if the terminology is not perfectly accurate. Option C. The assistant should avoid using any optometric terms that they are not absolutely certain of, opting for simpler, less precise language to prevent potential misunderstandings. Option D. The assistant should consult with the supervising optometrist or a designated senior colleague to confirm the meaning and appropriate patient-facing explanation of any unfamiliar optometric term before using it. Correct answer is D. The assistant should consult with the supervising optometrist or a designated senior colleague to confirm the meaning and appropriate patient-facing explanation of any unfamiliar optometric term before using it. Explanation. The efficiency study reveals a recurring issue where optometric assistants are misinterpreting common optometric terms during patient interactions, leading to patient confusion and potential delays in care. This scenario is professionally challenging because it directly impacts patient understanding and trust, which are foundational to optometric practice. The role of an optometric assistant is to support the optometrist and facilitate patient care, which includes clear communication. Misunderstanding terminology can lead to incorrect information being relayed, potentially affecting a patient's adherence to treatment plans or their understanding of their eye health. The correct approach involves the optometric assistant actively seeking clarification when unsure of a term's meaning or its appropriate use in patient communication. This demonstrates a commitment to accuracy and patient welfare, aligning with the ethical obligations of healthcare professionals to provide clear and understandable information. Specifically, within the ROA framework for optometric assistants, maintaining accurate patient records and facilitating effective communication are paramount. By asking for clarification, the assistant ensures they are using terms correctly, thereby upholding professional standards and preventing misinformation. This proactive approach also contributes to the overall efficiency of the practice by reducing the need for follow-up explanations or corrections. An incorrect approach would be to guess the meaning of a term or to use it in a context where its meaning is uncertain. This failure to seek clarification represents a significant regulatory and ethical lapse. Under the ROA guidelines, optometric assistants are expected to operate within their scope of practice and to ensure the accuracy of information provided to patients. Guessing terminology can lead to the dissemination of incorrect information, which could be detrimental to patient care and could be seen as a breach of professional conduct. Another incorrect approach would be to avoid using any potentially ambiguous terms altogether, which would hinder effective communication and patient education, thereby failing to meet the support role expected of an optometric assistant. This avoidance also fails to address the root cause of the efficiency issue identified in the study. The professional decision-making process for similar situations should involve a commitment to continuous learning and a willingness to admit when knowledge is incomplete. When faced with an unfamiliar or uncertain term, an optometric assistant should prioritize patient understanding and accuracy. This involves consulting practice protocols, referring to approved glossaries or resources, or directly asking the supervising optometrist for clarification before communicating with the patient. This systematic approach ensures that all interactions are professional, accurate, and in line with regulatory requirements. Question 3. Compliance review shows that an optometric assistant is interacting with a patient who reports experiencing new, noticeable floaters in their vision. The patient describes them as small, dark spots or lines that drift across their field of vision. Considering the anatomy and physiology of the eye, what is the most appropriate immediate action for the optometric assistant to take? Adhering strictly to the ROA regulatory framework for optometric assistants. Option A. Document the patient's complaint and inform the supervising optometrist immediately for further assessment and management. Option B. Reassure the patient that floaters are common and often harmless, advising them to monitor the symptoms. Option C. Advise the patient to try blinking more frequently, as this can sometimes help to clear the visual field. Option D. Explain to the patient that the floaters are likely due to age-related changes in the vitreous humor, and no further action is needed. The correct answer is A. Document the patient's complaint and inform the supervising optometrist immediately for further assessment and management. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the optometric assistant to interpret patient-reported symptoms and relate them to potential anatomical or physiological issues within the eye, while also adhering to strict professional boundaries and referral protocols. Misinterpreting symptoms or overstepping the scope of practice can lead to delayed or incorrect diagnosis, patient harm, and regulatory noncompliance. The challenge lies in balancing patient care with the defined roles and responsibilities of an optometric assistant. Correct approach analysis. The correct approach involves recognizing the patient's description of seeing floaters as a potential symptom that warrants further investigation by a qualified optometrist. This aligns with the optometric assistant's role in assisting with patient care and preliminary assessments. Specifically, understanding that floaters can be a normal physiological change, e.g., vitreous detachment, but can also be indicative of serious conditions like retinal tears or detachment, necessitates a prompt and appropriate referral. This approach upholds the principle of patient safety and ensures that diagnostic and treatment decisions are made by the licensed practitioner, adhering to the ROA, Regulatory Authority for Optometry, guidelines for scope of practice and patient referral. Incorrect approach is analysis. One incorrect approach is to dismiss the patient's concern as insignificant or a normal part of aging without further assessment. This fails to acknowledge the potential for serious underlying pathology and breaches the ethical duty of care. It also violates ROA guidelines that mandate reporting all patient symptoms and concerns to the supervising optometrist for proper evaluation. Another incorrect approach is to attempt to diagnose the cause of the floaters or provide specific medical advice. This directly oversteps the optometric assistant's scope of practice as defined by the ROA. Providing a diagnosis or treatment recommendation without a license is illegal and unethical, potentially leading to incorrect self-treatment by the patient and delaying professional medical intervention. A further incorrect approach is to simply document the symptom without any recommendation for further action or referral. While documentation is important, failing to escalate a potentially significant symptom to the optometrist for evaluation is a dereliction of duty and a failure to ensure timely patient care, which is a core expectation under ROA regulations. Professional reasoning. When faced with a patient reporting symptoms like floaters, an optometric assistant should follow a structured decision-making process. 1. Listen attentively and document the patient's complaint accurately. 2. Assess the urgency based on the symptom's nature and any associated red flags, e.g., sudden onset, flashes of light, vision loss. 3. Recognize the symptom's potential anatomical/physiological basis, e.g., vitreous humor changes. 4. Immediately report the symptom and any observed signs to the supervising optometrist. 5. Follow the optometrist's instructions regarding further patient management, which will likely involve a comprehensive eye examination. 6. Never attempt to diagnose, treat, or provide definitive medical advice. Question 4. Consider a scenario where a patient reports experiencing a sudden onset of numerous small, dark spots floating in their vision, accompanied by brief, bright flashes of light in their peripheral vision. As an optometric assistant, what is the most appropriate immediate action to take regarding this patient's reported symptoms? Option A. Document the patient's reported symptoms of sudden floaters and flashes of light, and immediately inform the optometrist of their potential urgency for prompt evaluation. Option B. Attempt to explain to the patient that the flashes are likely due to vitreous traction and the floaters are normal age-related changes. Option C. Advise the patient that these symptoms are likely a minor issue and schedule them for a routine follow-up appointment in a few weeks. Option D. Reassure the patient that these symptoms are often benign and can be related to normal aging, advising them to monitor it. Correct answer is A. Document the patient's reported symptoms of sudden floaters and flashes of light, and immediately inform the optometrist of their potential urgency for prompt evaluation. Explanation. Scenario analysis. This scenario presents a professional challenge because an optometric assistant must recognize the potential severity of a patient's reported symptoms and understand their physiological implications without overstepping their scope of practice. The assistant needs to accurately relay information to the optometrist while demonstrating an understanding of how common eye diseases manifest, ensuring patient safety and appropriate care progression. The challenge lies in balancing patient communication with the limitations of their role, avoiding misdiagnosis, or providing treatment advice. Correct approach analysis. The correct approach involves recognizing the patient's symptoms, sudden onset of floaters and flashes of light, as potentially indicative of retinal detachment, a serious condition requiring immediate optometric evaluation. The physiological impact of retinal detachment is the separation of the retina from the underlying choroid, leading to a lack of oxygen and nutrients, which can cause irreversible vision loss if not treated promptly. By clearly and concisely documenting these specific symptoms and their potential urgency to the optometrist, the assistant facilitates a timely and appropriate clinical response, adhering to professional standards of care and patient advocacy within their defined role. This aligns with the ROA framework's emphasis on accurate patient information gathering and prompt referral when necessary. Incorrect approach is analysis. One incorrect approach would be to dismiss the patient's symptoms as minor or age-related without further investigation or reporting. This fails to acknowledge the physiological danger of retinal detachment, which can lead to permanent vision loss. Ethically and regulatorily, this constitutes a failure to act with due diligence and could be considered negligence, as it delays potentially sight-saving intervention. Another incorrect approach would be to attempt to diagnose the condition or provide reassurance that it is not serious. This directly violates the scope of practice for an optometric assistant, as diagnosis and treatment recommendations are the exclusive domain of the optometrist. Such an action could lead to a false sense of security for the patient, further delaying necessary care and potentially causing harm. This breaches professional boundaries and regulatory guidelines. A third incorrect approach would be to simply record the symptoms without conveying their potential urgency or the physiological implications to the optometrist. While documenting is important, failing to highlight the critical nature of symptoms like sudden flashes and floaters, which are classic signs of retinal detachment, means the optometrist may not prioritize the patient's examination appropriately. This can lead to a delay in diagnosis and treatment, impacting patient outcomes and potentially violating the duty of care. Professional reasoning. Professionals should employ a systematic approach when encountering patient symptoms. This involves active listening to understand the patient's complaint fully, recognizing key indicators of potentially serious conditions based on their training, and understanding the physiological basis of common eye diseases. The decision-making framework should prioritize patient safety, adherence to scope of practice, and clear, accurate communication with the supervising optometrist. When in doubt about the severity or nature of a symptom, the default action should be to escalate to the optometrist for professional assessment. Question 5. The investigation demonstrates a patient complaining of a sudden onset of blurry vision in their right eye, describing it as if a curtain is being drawn across their sight. They also report seeing flashes of light in the periphery of that same eye. Based on your understanding of the function of the eye's components, which of the following is the most appropriate initial consideration for the optometrist to investigate further? Option A. The conjunctiva, because inflammation of this membrane can cause redness and irritation, potentially affecting vision. Option B. The lens, as its ability to change shape for focusing is essential and clouding could cause blurriness. Option C. The vitreous humor, due to its role in maintaining the eye's shape and its potential to detach or cause floaters, which can be associated with flashes and visual disturbances. Option D. The cornea, as its transparency is crucial for light refraction, and any opacities could lead to blurred vision. The correct answer is C. The vitreous humor, due to its role in maintaining the eye's shape and its potential to detach or cause floaters, which can be associated with flashes and visual disturbances. Explanation. This scenario presents a common challenge for an optometric assistant, interpreting patient-reported symptoms and correlating them with potential underlying physiological issues within the eye's structure. The difficulty lies in bridging the gap between subjective patient experience and objective anatomical function, requiring the assistant to apply their knowledge of ocular anatomy and physiology accurately and ethically. The assistant must avoid making diagnoses, which is outside their scope of practice, while still providing helpful information to the optometrist. The correct approach demonstrates best professional practice by focusing on the patient's description of their visual experience and relating it to the known functions of specific eye components without overstepping professional boundaries. This aligns with the ROA, Registrar of Optometrists, guidelines, which emphasize accurate patient communication and support for the optometrist's diagnostic process. By identifying the likely affected component based on the symptom description, the assistant is preparing relevant information for the optometrist, thereby facilitating efficient and effective patient care. This also upholds the ethical principle of patient-centered care by acknowledging and addressing the patient's concerns in a structured manner. An incorrect approach that focuses solely on the patient's discomfort without attempting to link it to an anatomical function fails to leverage the assistant's specialized knowledge and misses an opportunity to provide valuable preliminary information to the optometrist. This could lead to a less efficient examination and potentially delay the optometrist's understanding of the situation. Another incorrect approach that attempts to diagnose the condition based on the symptom is a direct violation of the ROA regulations. Optometric assistants are not licensed to diagnose eye conditions. Such an action constitutes practicing optometry without a license, which carries significant legal and ethical repercussions, including disciplinary action from the ROA and potential harm to the patient. A further incorrect approach that dismisses the patient's symptoms as insignificant or unrelated to the eye's function is unprofessional and unethical. It disregards the patient's experience and can erode patient trust. While the assistant may not be able to definitively link every symptom to an ocular component, a dismissive attitude is contrary to the principles of good patient care and the supportive role of an optometric assistant. The professional decision-making process in such situations involves 1. Actively listening to and documenting the patient's reported symptoms accurately. 2. Applying knowledge of ocular anatomy and physiology to hypothesize which component might be involved based on the described symptoms. 3. Communicating these observations and hypotheses clearly and concisely to the supervising optometrist. 4. Strictly adhering to the scope of practice, avoiding any diagnostic statements or treatment recommendations. 5. Prioritizing patient comfort and reassurance throughout the interaction. Question 6. Upon reviewing a patient presenting with redness and mild swelling of the upper eyelid, accompanied by a gritty sensation and occasional tearing, what is the most appropriate risk assessment approach for an optometric assistant to take, considering the potential for accessory structure involvement? Option A. Advise the patient to use over-the-counter lubricating eye drops and monitor the symptoms for a few days. Option B. Attempt to palpate the lacrimal sac area to assess for tenderness or swelling, and then advise the patient on hygiene practices. Option C. Document the symptoms and signs and immediately inform the supervising optometrist for further assessment and management. Option D. Suggest a warm compress and gentle eyelid massage and instruct the patient to return if symptoms worsen. The correct answer is C. Document the symptoms and signs and immediately inform the supervising optometrist for further assessment and management. Explanation. This scenario presents a professional challenge due to the potential for misinterpreting subtle signs of infection or inflammation in the accessory structures of the eye, which can have significant implications for patient vision and comfort. The optometric assistant must exercise careful judgment to differentiate between minor, self-limiting conditions and those requiring immediate clinical attention, adhering strictly to the ROA framework for optometric assistants. The correct approach represents best professional practice because it prioritizes patient safety and timely intervention, aligning with the ROA's emphasis on recognizing and reporting potential health concerns. By accurately identifying signs of blepharitis and lacrimal sac inflammation, the assistant ensures the patient receives appropriate care, preventing potential complications such as preseptal cellulitis or dacryocystitis, which could impact vision and require more complex treatment. This proactive stance is crucial for maintaining the integrity of the patient's ocular health and upholding professional standards. An incorrect approach that involves dismissing the patient's symptoms as minor irritation without further investigation fails to meet the ROA's requirement for diligent observation and reporting. This oversight could lead to delayed diagnosis and treatment, potentially exacerbating the condition and causing patient harm, which is a direct violation of ethical practice and patient care standards. Another incorrect approach, such as attempting to diagnose or prescribe treatment without the direct supervision of an optometrist, exceeds the scope of practice for an optometric assistant as defined by the ROA. This action not only breaches professional boundaries, but also poses a risk to the patient by potentially administering inappropriate interventions. Finally, an incorrect approach that involves documenting the findings but not escalating the concern to the supervising optometrist for assessment and management would be a failure in communication and patient advocacy. The ROA framework mandates clear communication channels and the timely reporting of all relevant clinical observations to ensure comprehensive patient care. Professionals should employ a decision-making framework that begins with a thorough assessment of the patient's reported symptoms and observed signs. This involves a systematic evaluation of the accessory structures, considering the patient's history and any contributing factors. If any signs or symptoms suggest a deviation from normal, the next step is to consult the ROA guidelines for appropriate reporting and escalation protocols. This ensures that all concerns are addressed promptly and effectively by the appropriate clinical personnel, prioritizing patient well-being and adherence to regulatory requirements. Question 7. Stakeholder feedback indicates that some optometric assistants are encountering challenges with the consistent and accurate interpretation of abbreviations and acronyms used in patient records and interprofessional communications. Considering the importance of precise information exchange in ophthalmic practice, which of the following actions best demonstrates adherence to professional standards for an optometric assistant when encountering an unfamiliar abbreviation? Option A. Seek clarification from a supervisor or consult an approved glossary of ophthalmic abbreviations. Option B. Attempt to deduce the meaning based on the surrounding text and common medical terminology. Option C. Ignore the abbreviation and proceed with the task, assuming it is not critical to the immediate action. Option D. Utilize the abbreviation in subsequent communications, assuming it is widely understood. Correct answer is B. Attempt to deduce the meaning based on the surrounding text and common medical terminology. Explanation. This scenario is professionally challenging because the optometric assistant is expected to communicate effectively and accurately with various stakeholders, including patients, other healthcare professionals, and administrative staff. Misinterpreting or misusing abbreviations and acronyms can lead to significant misunderstandings, potentially impacting patient care, appointment scheduling, and billing accuracy. The ROA, Royal College of Ophthalmologists framework, while not a direct regulatory body for optometric assistants in the same way as a licensing board, emphasizes professional conduct and the importance of clear communication within the ophthalmic community. Adherence to established professional standards and guidelines is paramount. The correct approach represents best professional practice because it prioritizes clarity, accuracy, and patient safety. By seeking clarification on unfamiliar abbreviations or acronyms, the optometric assistant demonstrates a commitment to understanding information correctly, thereby preventing errors and ensuring that patient records and communications are precise. This aligns with the general ethical principles of healthcare professionals to act in the best interest of the patient and to maintain professional competence. While specific ROA guidelines on abbreviations might not be explicitly detailed for assistants, the overarching principle of accurate record-keeping and communication is implicit in professional ophthalmic practice. An incorrect approach that involves guessing the meaning of an abbreviation is professionally unacceptable because it introduces a high risk of error. This could lead to misdiagnosis, incorrect treatment plans, or administrative mistakes, all of which compromise patient safety and could have legal or disciplinary repercussions. Relying on assumptions rather than verified information violates the principle of due diligence and professional responsibility. Another incorrect approach, such as using an abbreviation without confirming its context or common usage, can lead to ambiguity. Different specialties or even individual practices might use acronyms differently, making a universally understood abbreviation in one context potentially confusing or misleading in another. This lack of precision can hinder effective communication between healthcare providers and potentially impact the continuity of care. Finally, an approach that involves ignoring an unfamiliar abbreviation altogether is also professionally unacceptable. This demonstrates a lack of engagement with the information presented and a failure to ensure complete understanding. In a healthcare setting, all information, including that conveyed through abbreviations, is potentially critical to patient care. The professional decision-making process for similar situations should involve a proactive approach to understanding. When encountering an unfamiliar abbreviation or acronym, the optometric assistant should: 1. Consult a reliable, practice-approved glossary or reference material. 2. If no clear definition is found, politely and professionally ask a supervisor or colleague for clarification. 3. If the abbreviation is critical to patient care and immediate clarification is not possible, err on the side of caution by using the full term or noting the ambiguity. This systematic approach ensures accuracy and upholds professional standards. Question 8. Examination of the data shows that a patient has been diagnosed with a condition affecting the anterior segment of their eye. When explaining this to the patient, which of the following approaches best aligns with the professional responsibilities of an optometric assistant operating under ROA guidelines? Option A. Describe the issue as a problem with the cornea, a term that is part of the eye's anatomy. Option B. State that the problem is with the front part of their eye, which is responsible for focusing light. Option C. Inform the patient that the diagnosis relates to the anterior segment, which is a general term for the front portion of the eye. Option D. Explain that the condition is affecting the cornea, which is the clear, dome-shaped outer surface of the eye that covers the iris, pupil, and anterior chamber. The correct answer is D. Explain that the condition is affecting the cornea, which is the clear, dome-shaped outer surface of the eye that covers the iris, pupil, and anterior chamber. Explanation. Scenario analysis. This scenario is professionally challenging because the optometric assistant must accurately interpret and communicate anatomical information to a patient who may have limited medical knowledge. Misunderstanding or miscommunicating these terms can lead to patient anxiety, non-compliance with treatment, and potentially impact the patient's understanding of their own eye health. The assistant's role requires a balance of technical accuracy and patient-centered communication, adhering to professional standards of care and patient privacy. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing clear, understandable communication while maintaining professional accuracy, using layman's terms that accurately describe the anatomical location, e.g., the front surface of your eye, rather than solely relying on technical jargon, e.g., cornea, ensures the patient can grasp the information. This aligns with the ethical obligation to provide patient education and informed consent, as mandated by optometric assistant guidelines which emphasize clear communication and patient understanding. It also implicitly respects the patient's right to understand their health status. Incorrect approach is analysis. An approach that solely uses highly technical anatomical terms without explanation fails to meet the professional obligation for patient education. This can lead to patient confusion and a lack of understanding, potentially violating ethical principles of informed consent and patient autonomy. It suggests a lack of empathy and a failure to adapt communication to the patient's level of understanding, which is a core competency for an optometric assistant. An approach that uses overly simplistic or inaccurate analogies can be misleading and unprofessional. While aiming for clarity, if the analogy distorts the actual anatomical function or location, it can lead to patient misconceptions about their condition or treatment. This deviates from the requirement for accurate information dissemination and could be considered a breach of professional duty to provide correct guidance. An approach that avoids explaining the anatomical term altogether, perhaps by simply stating a diagnosis without context, is a failure in patient communication. This leaves the patient uninformed about the physical basis of their condition, hindering their ability to participate in their care or understand the rationale behind recommended treatments. It neglects the fundamental role of the optometric assistant in supporting the optometrist's diagnostic and treatment plan through effective patient communication. Professional reasoning. Professionals should adopt a patient-centered communication strategy. This involves first understanding the patient's existing knowledge and comfort level with medical terminology. When anatomical terms are necessary, the professional should strive to explain them using clear, concise language, often employing analogies if they are accurate and helpful. The goal is to empower the patient with understanding, fostering trust, and facilitating adherence to care plans. This process aligns with regulatory frameworks that emphasize patient education, informed consent, and ethical conduct in healthcare settings. Question 9. Performance analysis shows that a patient, after a comprehensive eye examination, expresses dissatisfaction with the initial lens prescription, stating, "These feel a bit blurry, and I'm not sure they are strong enough, even though the optometrist said they're correct. I'd prefer something stronger, like my old glasses." The optometric assistant has reviewed the objective refraction data and the optometrist's notes, which confirm the prescribed lenses accurately correct the patient's refractive error and address their binocular vision needs according to standard protocols. The patient appears anxious about the slight adjustment period. How should the optometric assistant proceed? Option A. Immediately agree to adjust the prescription to be stronger as requested by the patient to alleviate their immediate concern and ensure their satisfaction. Option B. Suggest that the patient's old glasses might be more comfortable and recommend they continue wearing them until they decide if they want to pursue a different prescription. Option C. Tell the patient that their perception of blurriness is subjective and likely due to them being overly sensitive, and that they should just get used to the new prescription. Option D. Explain to the patient that the prescribed lenses are the most accurate correction based on the examination, and gently reassure them that visual adjustments to new prescriptions are common and usually resolve within a few days, offering to schedule a follow-up if symptoms persist. The correct answer is D. Explain to the patient that the prescribed lenses are the most accurate correction based on the examination, and gently reassure them that visual adjustments to new prescriptions are common and usually resolve within a few days, offering to schedule a follow-up if symptoms persist. Explanation. This scenario presents a professional challenge because it requires the optometric assistant to balance the patient's stated preference with the objective findings of the vision assessment, while adhering to professional standards and ethical obligations. The assistant must recognize that patient comfort and perceived visual experience are important, but they do not supersede the clinical necessity of ensuring optimal visual function and eye health. Core of the challenge lies in communicating complex visual science concepts in an understandable way to the patient and advocating for the most appropriate course of action based on the examination results, rather than solely on the patient's initial request. The correct approach represents best professional practice because it prioritizes the patient's long-term visual health and functional vision. By explaining the scientific rationale behind the recommended lens prescription, the assistant empowers the patient with knowledge and builds trust. This approach aligns with the ethical duty to provide competent care and to act in the patient's best interest, as guided by the principles of optometric practice and the ROA framework. It involves a thorough understanding of how different refractive errors and visual conditions impact visual acuity, binocular vision, and overall visual comfort, and translating this into a clear, patient-centered explanation. An incorrect approach that focuses solely on fulfilling the patient's initial request without further investigation or explanation would be professionally unacceptable. This fails to uphold the standard of care, as it may lead to a suboptimal prescription that does not fully correct the refractive error or address underlying visual issues. It could also be interpreted as a failure to exercise professional judgment, potentially leading to patient dissatisfaction or even harm if the uncorrected or undertreated condition progresses. Furthermore, it bypasses the opportunity to educate the patient about their vision, which is a crucial aspect of patient care and compliance. Another incorrect approach, such as dismissing the patient's concerns or becoming defensive, is ethically unsound and unprofessional. This erodes the patient-practitioner relationship and demonstrates a lack of empathy and respect for the patient's experience. It also fails to address the underlying reasons for the patient's initial request, which might stem from a misunderstanding of their visual needs or a previous negative experience. The professional decision-making process for similar situation should involve a systematic approach. 1. Actively listen to and acknowledge the patient's concerns and preferences. 2. Conduct a thorough and accurate vision assessment. 3. Interpret the objective findings in conjunction with the patient's subjective report. 4. Formulate a diagnosis and a treatment plan based on clinical evidence and best practices. 5. Clearly and empathetically communicate the findings and the rationale for the recommended treatment to the patient, using language they can understand. 6. Address any patient questions or objections with patience and respect. 7. Collaborate with the patient to reach a mutually agreeable plan that prioritizes their visual health and functional vision. 8. Document all findings, discussions, and decisions thoroughly. Question 10. The assessment process reveals a patient complaining of experiencing glare and halos around lights, particularly at night, and describes the light as feeling too bright, even in moderately lit environments. Which of the following best reflects an optometric assistant's understanding of the basic principles of light and optics in relation to this patient's reported symptoms? Option A, suggesting that the patient simply needs stronger prescription lenses to compensate for the perceived brightness. Option B, recognizing that glare and halos can be indicative of light scattering within the optical media of the eye, potentially due to changes in the lens or cornea, and that increased brightness perception might relate to pupil size or light sensitivity. Option C, concluding that the patient is likely experiencing early-stage cataracts and advising them to schedule surgery. Option D, dismissing the symptoms as a common annoyance that most people experience and not requiring further investigation. Correct answer is B, recognizing that glare and halos can be indicative of light scattering within the optical media of the eye, potentially due to changes in the lens or cornea, and that increased brightness perception might relate to pupil size or light sensitivity. Explanation. The assessment process reveals a common scenario where an optometric assistant must interpret patient-reported symptoms related to light sensitivity. This is professionally challenging because the assistant must bridge the gap between subjective patient experience and objective optical principles without overstepping their scope of practice or providing medical advice. Accurate interpretation is crucial for effective communication with the optometrist and ensuring appropriate patient care. The correct approach involves recognizing the patient's description of light sensitivity and relating it to fundamental optical concepts like light scattering and aberrations. This demonstrates an understanding of how light interacts with the visual system and how various conditions can affect this interaction. By identifying potential optical causes for the patient's discomfort, the assistant can accurately relay this information to the optometrist, facilitating a more targeted examination. This aligns with the ROA framework's emphasis on accurate observation, reporting, and understanding of basic optical principles to support the optometrist's diagnostic process. An incorrect approach would be to dismiss the patient's symptoms as insignificant or to attempt to diagnose the underlying cause. Dismissing symptoms fails to acknowledge the patient's experience and can lead to missed diagnostic opportunities, violating the ethical duty of care. Attempting to diagnose is a direct violation of the optometric assistant's scope of practice, which is to assist the optometrist, not to perform diagnostic functions. Furthermore, providing a definitive diagnosis without the optometrist's assessment could lead to incorrect patient management and potential harm, contravening regulatory guidelines that define professional boundaries. Another incorrect approach is to focus solely on the patient's subjective complaint without considering the underlying optical principles. While empathy is important, an optometric assistant's role is to provide objective information and support. Failing to connect the symptom to potential optical phenomena means the information relayed to the optometrist may be less useful, hindering the diagnostic process. This demonstrates a lack of understanding of the fundamental optical principles that underpin optometric care. The professional reasoning process in such a situation should involve 1. Actively listening to and acknowledging the patient's reported symptoms. 2. Considering how these symptoms might relate to basic principles of light and optics as understood within the ROA framework. 3. Accurately and objectively documenting the patient's description of their experience. 4. Communicating these observations clearly and concisely to the supervising optometrist, highlighting any potential optical correlations identified. 5. Refraining from offering diagnoses or medical advice. Question 11. Analysis of a patient presenting for an eye examination states, "When I look at straight lines, they seem to bend or wiggle, especially when I'm tired." Which of the following optometric terms most accurately reflects this patient's description? Option A, photophobia. Option B, astigmatism. Option C, diplopia. Option D, metamorphopsia. Correct answer is C, diplopia. Explanation. Scenario analysis. This scenario presents a common challenge in optometric practice where a patient uses non-standard terminology to describe their visual experience. The optometric assistant must accurately interpret the patient's subjective description and translate it into precise, professional optometric terminology. Misinterpreting the patient's description can lead to incorrect documentation, miscommunication with the optometrist, and potentially affect the diagnostic and treatment process. The challenge lies in bridging the gap between layman's terms and technical optometric language while maintaining patient rapport and ensuring accurate record-keeping. Correct approach analysis. The correct approach involves actively listening to the patient's description, asking clarifying questions to understand the nature of their visual complaint, and then using their responses to identify the most appropriate optometric term. For instance, if a patient describes seeing blurry spots or things looking fuzzy, the assistant should consider terms like floaters or blurriness, respectively, and then confirm with the patient. This approach aligns with the ROA Registrar of Optometrists Australia guidelines, which emphasize accurate patient communication and record keeping. It ensures that the patient's subjective experience is accurately captured and communicated to the optometrist, facilitating a correct diagnosis and treatment plan. This demonstrates professional competence and adherence to ethical standards of patient care. Incorrect approach is analysis. One incorrect approach is to dismiss the patient's description as irrelevant or to assume understanding without clarification. This fails to acknowledge the patient's subjective experience and can lead to incomplete or inaccurate information being passed to the optometrist. Ethically, it breaches the duty of care to fully understand and address the patient's concerns. Another incorrect approach is to guess the optometric term without proper clarification. This is professionally risky, as it can lead to misdiagnosis and inappropriate treatment. It also demonstrates a lack of diligence and adherence to professional standards for accurate documentation. A third incorrect approach is to use overly technical jargon when communicating with the patient, further confusing them and potentially leading to misinterpretation of their own symptoms. This violates principles of clear communication and patient-centered care, which are implicitly expected under the ROA framework. Professional reasoning. Professionals should employ a systematic approach. 1. Active listening. Pay close attention to the patient's exact words and tone. 2. Clarification. Ask open-ended questions to elicit more detail about the visual symptom. Example, can you describe what you mean by wavy? Or when you say double vision, is it one image split into two or are there two distinct images? 3. Translation. Based on the clarified description, identify the most fitting optometric terminology. 4. Confirmation. Briefly rephrase the symptom using the optometric term and ask the patient if that accurately reflects their experience. For example, so, you're experiencing intermittent blurriness, particularly when reading. 5. Documentation. Record the patient's description and the interpreted optometric term accurately in the patient's chart. This process ensures that the patient's subjective experience is accurately translated into objective, professional terminology, facilitating effective communication and optimal patient care within the regulatory framework. Question 12. The monitoring system demonstrates a patient reporting that when looking at a bright light source through their new prescription glasses, the light appears to bend or spread out more than before. Which of the following explanations best aligns with the principles of refraction and reflection as they relate to corrective lenses and patient education within the scope of an optometric assistant? Option A. The lenses are designed to refract light, bending it to focus on the retina, and the observed effect is a consequence of how the specific curvature of these lenses alters the path of light rays from a bright source. Option B. The patient is likely experiencing a temporary adaptation period, and the visual phenomenon will resolve on its own without further explanation. Option C. The bright light is causing a physiological response in the patient's retina, and the glasses are not directly influencing this specific visual distortion. Option D. The monitoring system indicates a potential defect in the lens coating, which is causing an unusual reflection pattern that needs immediate recalibration by a technician. The correct answer is A. The lenses are designed to refract light, bending it to focus on the retina, and the observed effect is a consequence of how the specific curvature of these lenses alters the path of light rays from a bright source. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the optometric assistant to interpret visual feedback from a patient regarding their subjective experience of light and vision, and to connect this to the objective principles of refraction and reflection without performing complex calculations. The assistant must understand how light interacts with the eye and corrective lenses to explain the patient's perception, ensuring patient understanding and trust while adhering to professional scope of practice. Correct approach analysis. The correct approach accurately explains the patient's visual experience by relating it to the principles of light refraction and reflection as they apply to corrective lenses. This aligns with the optometric assistant's role in patient education and support, as outlined by ROA guidelines, which emphasize clear communication and patient comprehension of optical principles relevant to their vision correction. It demonstrates an understanding of how lenses alter light paths to achieve clearer vision, directly addressing the patient's observation. Incorrect approach is analysis. One incorrect approach fails to connect the patient's observation to the underlying optical principles, offering a vague or irrelevant explanation. This violates the ROA's emphasis on providing clear and informative patient education, potentially leading to patient confusion or distrust. It suggests a lack of understanding of how refractive errors and their correction manifest visually. Another incorrect approach might overstep the optometric assistant's scope of practice by attempting to diagnose or prescribe, or by providing overly technical jargon that the patient cannot understand. ROA guidelines strictly define the boundaries of practice for assistants, and exceeding these can lead to regulatory issues and compromise patient care. A third incorrect approach might dismiss the patient's observation as insignificant or incorrect without proper investigation. This demonstrates poor patient care and a failure to acknowledge the patient's subjective experience, which is a crucial component of effective vision correction. It neglects the principle of patient-centered care and the importance of addressing all patient concerns. Professional reasoning. Professionals should approach such situations by first actively listening to the patient's description of their visual experience. Then, they should access their knowledge of basic optical principles, refraction, reflection, lens properties, and relate these to the patient's observation in simple, understandable terms. If the patient's observation suggests a potential issue with the current correction or a need for further assessment, the assistant should follow established protocols for escalating the concern to the optometrist, rather than attempting to resolve it independently or dismiss it. The decision-making process involves prioritizing patient understanding, adhering to scope of practice, and ensuring appropriate referral when necessary. Question 13. The control framework reveals that an optometric assistant is explaining a new eyeglass prescription to a patient. The prescription notes are -1, 00-0, 75x180 and L-1, 25-0, 50x90. When the patient asks what astigmatism means, which of the following explanations best adheres to the ROA standards for patient communication and optometric terminology? Option A. Astigmatism is just a technical term for blurry vision that isn't very important for you to understand. Option B. Astigmatism is a type of farsightedness that occurs when the eye cannot focus light properly. Option C. Astigmatism is a common refractive error where the eye's cornea or lens has an irregular shape, causing light to focus unevenly on the retina, resulting in blurred or distorted vision at all distances. Option D. Astigmatism is a disease that affects the optic nerve and can lead to vision loss. The correct answer is C. Astigmatism is a common refractive error where the eye's cornea or lens has an irregular shape, causing light to focus unevenly on the retina, resulting in blurred or distorted vision at all distances. Explanation. The control framework reveals that accurate and precise communication of optometric terminology is paramount for patient safety and effective care delivery within the ROA framework. Misinterpreting or misusing these terms can lead to incorrect diagnoses, inappropriate treatment plans, and ultimately, compromised patient outcomes. This scenario is professionally challenging because it requires the optometric assistant to not only understand the technical meaning of specific optometric terms, but also to apply that understanding in a practical, patient-facing context, ensuring clarity and avoiding ambiguity. The correct approach represents best professional practice because it demonstrates a thorough understanding of the specific optometric terminology as defined and utilized within the ROA regulatory guidelines. By accurately identifying and explaining the term astigmatism in a way that is both technically correct and comprehensible to a patient, the optometric assistant upholds the ROA's emphasis on clear patient communication and education. This aligns with the ethical obligation to ensure patients are informed about their eye health and treatment options, fostering trust and facilitating adherence to recommended care. An incorrect approach that misdefines astigmatism as a form of farsightedness represents a significant regulatory and ethical failure. This misstatement directly contravenes the ROA's requirement for accurate information dissemination, could lead the patient to believe they have a condition they do not, causing unnecessary anxiety or leading them to disregard the actual diagnosis and treatment. Another incorrect approach, defining astigmatism as a disease of the optic nerve, is factually incorrect and demonstrates a fundamental lack of understanding of basic ocular anatomy and common refractive errors, a critical failure in professional competence expected under ROA guidelines. Finally, an approach that dismisses the term as unimportant or too technical for the patient to understand ignores the ROA's mandate for patient empowerment through knowledge and could be interpreted as a failure to provide adequate patient care and education. Professionals should employ a decision-making process that prioritizes accuracy, clarity, and patient understanding. This involves a continuous commitment to learning and reinforcing optometric terminology, cross-referencing with ROA guidelines when in doubt, and practicing clear, concise communication techniques tailored to the patient's level of understanding. When faced with a term that requires explanation, the professional should first confirm their own understanding, then formulate an explanation that is both scientifically accurate and easily digestible, always ensuring it aligns with the established standards of practice within the ROA framework. Question 14. Research into a patient's expressed preference for refractive surgery as their sole desired method of vision correction, despite having no prior consultation regarding their suitability or alternative options, requires an optometric assistant to consider which of the following as the most appropriate initial course of action within the ROA framework. Option A. Schedule a comprehensive eye examination to assess the patient's ocular health and visual needs, and discuss all appropriate methods of vision correction, including glasses, contact lenses, and refractive surgery, detailing their respective benefits and limitations. Option B. Immediately refer the patient to a refractive surgery clinic for consultation, as this is their stated preference. Option C. Inform the patient that as an optometric assistant, you cannot discuss surgical options and they must seek advice directly from an ophthalmologist. Option D. Advise the patient that refractive surgery is a complex procedure and they should only consider glasses as a safer and more straightforward option. The correct answer is A. Schedule a comprehensive eye examination to assess the patient's ocular health and visual needs, and discuss all appropriate methods of vision correction, including glasses, contact lenses, and refractive surgery, detailing their respective benefits and limitations. Explanation. This scenario presents a common challenge in optometric practice, where a patient expresses a desire for a specific refractive correction method without a thorough understanding of its suitability or alternatives. The challenge lies in balancing patient autonomy with the optometric assistant's professional responsibility to ensure the patient receives the most appropriate and safe vision correction, adhering to the ROA framework. A critical judgment is required to guide the patient towards a decision based on their ocular health, visual needs, and the evidence-based efficacy of different correction methods, all within the scope of practice for an optometric assistant. The correct approach involves a comprehensive assessment of the patient's visual requirements and ocular health, followed by an informed discussion about all suitable methods of correction. This includes explaining the benefits, limitations, risks, and contraindications of glasses, contact lenses, and refractive surgery, empowering the patient to make an informed choice in consultation with the optometrist. This aligns with the ROA's emphasis on patient-centered care and the ethical obligation to provide accurate, unbiased information to facilitate informed consent. It upholds the principle of do no harm by ensuring the chosen correction method is appropriate for the individual's specific circumstances. An incorrect approach would be to immediately agree to the patient's stated preference for refractive surgery without a full evaluation. This fails to consider potential contraindications or risks associated with surgery, potentially leading to adverse outcomes and violating the ROA's duty of care. Another incorrect approach would be to dismiss the patient's interest in contact lenses without exploring their suitability, potentially limiting their options unnecessarily. Similarly, advocating solely for glasses without considering other viable alternatives, especially if the patient expresses interest in them, would be a failure to provide comprehensive care. These approaches demonstrate a lack of thoroughness and a failure to uphold the ethical standards of providing complete and balanced information regarding all appropriate vision correction methods. The professional decision-making process for similar situations should begin with active listening to the patient's expressed desires and concerns. This should be followed by a systematic evaluation of their visual needs and ocular health, gathering all necessary clinical data. Subsequently, a clear, understandable explanation of all relevant correction methods should be provided, detailing their pros, cons, and suitability for the individual. The role of the optometric assistant is to facilitate this understanding and to present the findings and options to the optometrist for final diagnosis and prescription, ensuring the patient is fully informed and comfortable with the recommended course of action. Question 15. Compliance review shows that an optometric assistant was tasked with assessing a patient's color vision. Which of the following approaches best reflects current best practices and regulatory expectations for an optometric assistant operating under the ROA framework? Option A. Relying on the patient's verbal description of their ability to distinguish colors without conducting any formal testing. Option B. Conducting a standardized color vision test, but skipping the step of verifying the lighting conditions in the examination room. Option C. Administering a recognized, standardized color vision test according to the manufacturer's instructions, ensuring appropriate lighting conditions, and accurately documenting the results. Option D. Using a set of colored pencils to ask the patient to sort them by shade, improvising the assessment based on the available materials. The correct answer is C. Administering a recognized, standardized color vision test according to the manufacturer's instructions, ensuring appropriate lighting conditions, and accurately documenting the results. Explanation. This scenario presents a professional challenge because accurately assessing and documenting color vision deficits is crucial for patient safety and appropriate management, especially in contexts where color discrimination is important for daily tasks or specific professions. The optometric assistant must adhere strictly to established protocols and the scope of practice defined by the ROA framework to ensure reliable and ethically sound results. The correct approach represents best professional practice because it involves utilizing a standardized, validated color vision test that is recognized within the optometric field and is appropriate for the patient's age and cognitive ability. Following the manufacturer's instructions meticulously, ensuring proper lighting conditions, and accurately recording the findings are all essential components of a reliable assessment. This aligns with the ROA's emphasis on evidence-based practice and accurate patient record-keeping, ensuring that the optometrist has the necessary information for diagnosis and treatment planning. An incorrect approach that involves using a non-standardized or improvised method for color vision testing is professionally unacceptable. This failure violates the ROA's requirement for using approved diagnostic tools and procedures, leading to potentially inaccurate results. Such an approach compromises patient care by providing unreliable data, which could lead to misdiagnosis or inappropriate recommendations. Furthermore, it demonstrates a lack of adherence to professional standards and ethical obligations to perform assessments competently. Another incorrect approach, such as relying solely on the patient's subjective report of their color perception without objective testing, is also a significant ethical and regulatory failure. While patient input is valuable, it cannot replace objective diagnostic measures. This approach neglects the ROA's mandate for thorough and objective patient evaluations, potentially overlooking underlying conditions or the severity of a deficit. It also fails to meet the standard of care expected in optometric practice. Finally, an incorrect approach that involves documenting findings without proper calibration of the testing equipment or without considering potential confounding factors like lighting would also be professionally unacceptable. This demonstrates a lack of diligence and attention to detail, which are critical for accurate assessment. The ROA framework implicitly requires that all diagnostic procedures be conducted under optimal conditions to ensure validity and reliability. The professional decision-making process for similar situations should involve 1. Identifying the specific diagnostic need. 2. Consulting the ROA guidelines and approved testing protocols for that need. 3. Selecting the most appropriate and validated assessment tool. 4. Ensuring all necessary conditions for testing are met, e.g., lighting, equipment calibration. 5. Performing the test according to manufacturer instructions and professional standards. 6. Accurately and comprehensively documenting all findings and any deviations from protocol. 7. Communicating results clearly to the supervising optometrist. Question 16. The risk matrix shows a moderate likelihood of patient presenting with a minor eye irritation complaint also having undiagnosed hypertension. During the preliminary visual acuity check and external eye examination, you observe subtle but distinct arteriolar narrowing and occasional arteriovenous nicking in the patient's fundus. The patient has not mentioned any other health concerns. What is the most appropriate immediate action? Option A. Inform the patient that they likely have hypertension based on your observations and recommend they see their general practitioner immediately. Option B. Record the fundoscopic findings in the patient's chart, but wait until the optometrist reviews the patient for other reasons before mentioning these specific observations. Option C. Advise the patient that their eye irritation is likely unrelated to any systemic issues and proceed with managing the irritation. Option D. Document the fundoscopic findings accurately and immediately report them to the supervising optometrist, highlighting the potential implications given the risk matrix. The correct answer is D. Document the fundoscopic findings accurately and immediately report them to the supervising optometrist, highlighting the potential implications given the risk matrix. Explanation. This scenario presents a professional challenge due to the optometric assistant's responsibility in identifying potential systemic health issues that manifest in the eye, even when the primary complaint is not directly related to vision loss. The challenge lies in recognizing subtle ocular signs that may indicate underlying conditions like diabetes or hypertension, which require referral to an optometrist for further evaluation and management. The assistant must balance their scope of practice with the ethical and regulatory obligation to ensure patient safety and well-being by escalating concerns appropriately. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the regulatory framework governing optometric assistance. By recognizing the potential implications of the observed ocular findings, e.g., microaneurysms, hemorrhages, or hypertensive retinopathy changes, in the context of the patient's reported symptoms, the assistant demonstrates a thorough understanding of how systemic diseases can affect ocular health. This approach aligns with the ROA guidelines, which emphasize the assistant's role in assisting the optometrist with patient care, including preliminary observations and reporting of any concerning findings that might warrant further investigation. Prompt and accurate reporting to the optometrist ensures timely diagnosis and management of potentially sight-threatening or life-threatening systemic conditions. An incorrect approach of dismissing the ocular findings as unrelated to the patient's stated complaint would be a significant regulatory and ethical failure. This demonstrates a lack of understanding of the interconnectedness of systemic health and ocular health, a core competency expected of an optometric assistant. It could lead to delayed diagnosis of serious conditions like diabetic retinopathy or hypertensive crisis, potentially resulting in irreversible vision loss or other severe health consequences for the patient. Ethically, it breaches the duty of care owed to the patient. Another incorrect approach of attempting to diagnose the systemic condition directly would exceed the optometric assistant's scope of practice as defined by the ROA. Assistants are trained to observe, record, and report, not to diagnose. Such an action would be a direct violation of regulatory boundaries and could lead to misdiagnosis and inappropriate patient advice, causing harm. A third incorrect approach of simply documenting the findings without escalating them to the optometrist is also a failure. While documentation is crucial, the assistant's role includes proactive identification and reporting of potential issues. Failing to inform the optometrist of potentially significant ocular signs, even if the patient's primary complaint is unrelated, means the assistant is not fulfilling their supportive role in comprehensive patient care and risk management. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the patient's presenting complaint and medical history. 2. Conduct preliminary ocular observations as per ROA guidelines. 3. Critically evaluate any observed ocular signs in the context of the patient's overall health information, considering common systemic conditions that affect the eye. 4. If any findings suggest a potential systemic issue, like diabetes or hypertension, or if the findings are concerning for any reason, immediately report these observations and concerns to the supervising optometrist. 5. Document all findings and communications accurately. Question 17. Which approach would be most appropriate for an optometric assistant working under ROA regulations when a patient presents with a combination of blurred distance vision and difficulty reading up close? Option A. Focus solely on the near vision complaint, assuming it is presbyopia, and proceed with near vision testing without assessing distance vision. Option B. Assume the patient has myopia due to blurred distance vision and recommend over-the-counter reading glasses for near vision issues. Option C. Advise the patient that their symptoms are common and suggests they try different prescription strengths of reading glasses until they find one that works for both distance and near. Option D. Conduct a comprehensive eye examination including subjective and objective refraction, visual acuity testing at distance and near, and assessment for astigmatism, to accurately identify all contributing refractive errors before consulting the optometrist. The correct answer is D. Conduct a comprehensive eye examination including subjective and objective refraction, visual acuity testing at distance and near, and assessment for astigmatism, to accurately identify all contributing refractive errors before consulting the optometrist. Explanation: scenario analysis. This scenario presents a common challenge in optometric practice where a patient exhibits symptoms that could be attributed to multiple refractive errors. Differentiating between myopia, hyperopia, astigmatism, and presbyopia, especially when symptoms overlap or are subtle, requires a systematic and thorough approach. The professional challenge lies in accurately identifying the primary refractive error, S, to ensure appropriate management and patient satisfaction, while adhering to professional standards and regulatory guidelines for patient care. Misdiagnosis can lead to ineffective treatment, patient frustration, and potential regulatory scrutiny. Correct approach analysis. The correct approach involves a comprehensive eye examination that includes subjective refraction, objective refraction, if indicated and within the scope of practice for an optometric assistant under supervision, and assessment of visual acuity at distance and near. This systematic process allows for the precise measurement of refractive error and the identification of specific visual disturbances. For example, a patient complaining of blurred distance vision might be myopic, but if they also report difficulty with near tasks, hyperopia or presbyopia could be contributing factors. Astigmatism would be identified by inconsistent blur at various distances or orientations. The optometric assistant's role, as defined by ROA regulations, is to assist the optometrist in these diagnostic processes, ensuring accurate data collection. This approach aligns with the ROA's emphasis on thorough patient assessment and accurate record keeping, which are fundamental to providing safe and effective optometric care. Incorrect approaches analysis. One incorrect approach would be to rely solely on a patient's subjective description of their vision problems without conducting objective measurements. For instance, assuming a patient with blurred distance vision is simply myopic without performing a refraction could overlook underlying astigmatism or hyperopia that might be contributing to their symptoms. This fails to meet the ROA standard for comprehensive examination and could lead to an incorrect diagnosis and prescription. Another incorrect approach would be to focus on only one potential refractive error based on a single symptom. For example, if a patient mentions difficulty reading, immediately assuming presbyopia without assessing distance vision or checking for astigmatism would be inadequate. Presbyopia is a specific age-related condition, whereas blurred near vision can also be a symptom of uncorrected hyperopia or astigmatism. This narrow focus neglects the possibility of coexisting refractive errors, which is a common occurrence and requires a broader diagnostic scope as mandated by professional optometric practice guidelines. A third incorrect approach would be to delegate diagnostic tasks beyond the defined scope of practice for an optometric assistant under ROA regulations. For instance, independently diagnosing and prescribing corrective lenses without optometrist oversight or performing advanced diagnostic tests not permitted for an assistant would be a direct violation of regulatory frameworks. The ROA framework clearly delineates the responsibilities and limitations of optometric assistants, emphasizing their supportive role in the diagnostic process. Professional reasoning. Professionals should approach patient care with a framework that prioritizes thoroughness, accuracy, and adherence to regulatory guidelines. This involves actively listening to patient complaints, but critically, it requires a systematic diagnostic process that objectively measures visual function. When presented with symptoms that could indicate multiple refractive errors, the decision-making process should involve 1. Gathering all subjective information, 2. Performing objective measurements within scope, 3. Correlating subjective and objective findings, 4. Considering all potential refractive error diagnoses, and 5. Consulting with the supervising optometrist for definitive diagnosis and treatment planning. This structured approach ensures that all possibilities are explored, leading to the most accurate diagnosis and appropriate patient care, thereby upholding professional standards and regulatory compliance. Question 18. The review process indicates that a patient has been diagnosed with a significant visual field defect affecting their peripheral vision. As an optometric assistant working under the ROA regulatory framework, how should you best communicate this diagnosis to the patient to ensure understanding and manage their concerns? Option A. Inform the patient that they have a scotoma in their visual field, which is a loss of vision in a specific area, and that the optometrist will discuss the implications. Option B. State that the visual field test results show an abnormality and that the optometrist will explain the findings in detail at their next appointment. Option C. Tell the patient that their peripheral vision is reduced and that they should be careful when moving around but avoid going into further detail to prevent unnecessary worry. Option D. Explain that the visual field defect means they have blind spots in their vision. Describe how this might affect their daily activities like driving or walking, and outline the optometrist's plan for further management and monitoring. The correct answer is D. Explain that the visual field defect means they have blind spots in their vision. Describe how this might affect their daily activities like driving or walking, and outline the optometrist's plan for further management and monitoring. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the optometric assistant to interpret and communicate complex visual pathway information to a patient who may have limited understanding of ophthalmological terminology. The challenge lies in balancing the need for accurate information with the patient's comprehension and emotional state, ensuring they are not overwhelmed or misled. The assistant must also adhere strictly to the scope of practice and regulatory guidelines for optometric assistants in the ROA jurisdiction. Correct approach analysis. The correct approach involves clearly explaining the implications of the visual field defect on the patient's vision, using understandable language, and reassuring them about the next steps. This aligns with the ROA's regulatory framework, which emphasizes patient education and clear communication as fundamental aspects of patient care. It also reflects ethical obligations to ensure informed consent and patient well-being by providing accurate, accessible information about their condition and treatment plan. This approach empowers the patient and fosters trust. Incorrect approaches analysis. One incorrect approach would be to simply state the diagnosis without further explanation or context. This fails to meet the ROA's regulatory requirement for patient education and can lead to patient anxiety and misunderstanding. Ethically, it breaches the duty of care by not adequately informing the patient about their condition. Another incorrect approach would be to use highly technical jargon that the patient is unlikely to understand. This also violates the ROA's guidelines on clear communication and patient comprehension. It is professionally negligent as it prevents the patient from understanding their own health status, hindering their ability to participate in their care. A third incorrect approach would be to dismiss the patient's concerns or downplay the significance of the visual field defect without a proper assessment of its impact. This is ethically unsound and potentially violates ROA regulations concerning patient dignity and the provision of appropriate care. It can lead to a breakdown in the patient-practitioner relationship and potentially delay necessary interventions. Professional reasoning. Professionals should approach such situations by first understanding the patient's current knowledge and emotional state. They should then translate complex medical information into simple, clear terms, focusing on the functional impact of the condition. It is crucial to confirm patient understanding through open-ended questions and to offer reassurance and support. Always operate within the defined scope of practice for an optometric assistant as per ROA regulations, and escalate to the optometrist for diagnosis and treatment planning. Question 19. The analysis reveals a patient presenting for a routine eye examination expresses concern about recent blurry vision and difficulty seeing in dim light, mentioning they have a family history of eye conditions. As an optometric assistant, what is the most appropriate course of action to address the patient's concerns while adhering to regulatory frameworks and ethical guidelines? Option A. Tell the patient that their symptoms are likely due to eye strain from computer use and that they should simply take more breaks, as this is a common issue that the optometrist will likely confirm. Option B. Reassure the patient that their symptoms are not serious and that they have nothing to worry about, as most vision changes are minor and resolve on their own. Option C. Acknowledge the patient's symptoms and family history, provide general, factual information about common age-related ocular diseases like cataracts, glaucoma, and macular degeneration, and clearly state that the optometrist will conduct a full examination to diagnose and discuss their specific condition and treatment options. Option D. Immediately inform the patient that their symptoms strongly suggest cataracts and advise them on specific home remedies and over-the-counter eye drops to manage the condition until their appointment. The correct answer is C. Acknowledge the patient's symptoms and family history. Provide general, factual information about common age-related ocular diseases like cataracts, glaucoma, and macular degeneration, and clearly state that the optometrist will conduct a full examination to diagnose and discuss their specific condition and treatment options. Explanation. Scenario analysis. This scenario presents a professional challenge because the optometric assistant is tasked with providing information about common ocular diseases to a patient who is experiencing symptoms. The challenge lies in balancing the need to inform and reassure the patient with the strict regulatory boundaries of an optometric assistant's scope of practice. Misinformation or exceeding one's professional remit can lead to patient harm, anxiety, and regulatory noncompliance. The optometric assistant must demonstrate a thorough understanding of their role in patient education, recognizing when to defer to the optometrist. Correct approach analysis. The correct approach involves acknowledging the patient's concerns, validating their experience, and clearly stating the optometric assistant's role in gathering information and preparing for the optometrist's examination. It emphasizes the importance of the optometrist's diagnosis and treatment plan. This aligns with the ROA, Royal College of Ophthalmologists, guidelines and general optometric practice regulations, which define the optometric assistant's scope as supportive, not diagnostic or prescriptive. Providing accurate, general information about common conditions without diagnosing or offering specific advice is within scope, but deferring definitive information and diagnosis to the optometrist is paramount for patient safety and regulatory adherence. Incorrect approach is analysis. An incorrect approach would be to attempt to diagnose the patient's condition based on their symptoms. This is a direct violation of the optometric assistant's scope of practice and ROA regulations, as diagnosis is the exclusive domain of the optometrist. It could lead to misdiagnosis, delayed or inappropriate treatment, and significant patient harm. Ethically, it breaches the trust placed in the professional by the patient and the regulatory body. Another incorrect approach would be to provide detailed, specific advice on managing a suspected condition, such as recommending over-the-counter treatments or specific lifestyle changes for a particular disease. This also exceeds the optometric assistant's scope and could interfere with the optometrist's diagnostic process and prescribed treatment plan, potentially causing harm or adverse interactions. It bypasses the necessary clinical assessment and professional judgment of the optometrist. A third incorrect approach would be to dismiss the patient's concerns without offering any relevant, general information or reassurance, and without clearly indicating that the optometrist will address their concerns. While not directly harmful, this demonstrates a lack of empathy and patient-centered care, which is an ethical expectation. It also fails to utilize the opportunity for appropriate patient education within the assistant's scope, potentially leaving the patient feeling unheard and anxious. Professional reasoning. Professionals should approach such situations by first actively listening to the patient's concerns. They should then assess what information can be provided within their defined scope of practice, focusing on general education about common conditions, without making specific references to the patient's symptoms as indicative of a particular disease. Crucially, they must clearly communicate that a definitive diagnosis and treatment plan will be provided by the optometrist. This involves a clear understanding of the ROA framework, ethical principles of patient care, and the importance of interprofessional collaboration, ensuring patient safety and regulatory compliance at all times. Question 20. Strategic planning requires understanding the intricate anatomy and physiology of the eye to effectively guide patient care. An elderly patient, experiencing mild discomfort, insists on applying a specific over-the-counter herbal poultice directly to their eyelids, believing it will improve their vision. You, as an optometric assistant, know from your training that the eyelid structure and the delicate nature of the cornea make direct application of such substances potentially irritating and ineffective for vision improvement, and that this approach is not supported by established optometric practice. What is the most appropriate course of action? Option A. Immediately refuse the patient's request and tell them their idea is foolish and will not work. Option B. Politely explain to the patient that while you understand their concern, applying the poultice directly to the eyelids is not a recommended or safe practice due to the eye's anatomy and physiology, and suggest discussing alternative evidence-based options with the optometrist. Option C. Apply the herbal poultice as requested by the patient to avoid upsetting them and to respect their autonomy. Option D. Agree to apply the poultice, and then immediately file a formal complaint against the patient for requesting an inappropriate treatment. The correct answer is B. Politely explain to the patient that while you understand their concern, applying the poultice directly to the eyelids is not a recommended or safe practice due to the eye's anatomy and physiology, and suggest discussing alternative evidence-based options with the optometrist. Explanation. This scenario presents a professional challenge due to the conflict between a patient's expressed wishes and the optometric assistant's understanding of appropriate care based on anatomical and physiological knowledge. The patient's insistence on a treatment that contradicts established understanding of ocular anatomy and physiology creates an ethical dilemma. The optometric assistant must balance patient autonomy with the duty of care and professional responsibility to ensure patient safety and well-being. The correct approach represents best professional practice because it prioritizes patient safety and ethical conduct. By gently explaining the anatomical and physiological limitations that make the patient's requested treatment ineffective or potentially harmful, the assistant upholds their professional duty. This involves communicating complex information clearly and empathetically, respecting the patient's concerns while guiding them towards evidence-based care. This aligns with the ROA framework's emphasis on patient welfare and the assistant's role in supporting the optometrist's clinical decisions. An incorrect approach that involves directly administering the requested treatment without further consultation or explanation would be a significant regulatory and ethical failure. This would violate the principle of do no harm by potentially causing adverse effects due to a misunderstanding of ocular anatomy and physiology. It would also undermine the optometrist's authority and the established scope of practice for an optometric assistant. Another incorrect approach, such as dismissing the patient's request outright without any explanation or attempt at communication, would be ethically problematic. While it avoids direct harm from an inappropriate treatment, it fails to respect patient autonomy and can lead to patient dissatisfaction and distrust. It also misses an opportunity to educate the patient and reinforce the importance of evidence-based eye care, which is a key aspect of professional responsibility. A third incorrect approach, such as agreeing to the treatment and then reporting the optometrist to a regulatory body without first attempting to resolve the situation through communication and consultation, is also professionally unsound. This bypasses the established channels for addressing concerns and could damage the professional relationship unnecessarily. The professional decision-making process should involve clear communication, consultation with the supervising optometrist, and adherence to established protocols for patient care and ethical conduct.